hi, I'm Christy. Is it okay if I sit in here?
Yeah, of course. It's okay if I have my cousin Tara with me.
Yeah, of course. Hi, Tara.
Hello. Okay, so what brings you in today?
I started having seizures about 2 weeks ago.
Okay. I'm just going to ask you some questions to help me get a better understanding of your medical history.
Okay.
Have you had any recent surgeries?
No.
Do you have anemia?
No.
Any childhood illnesses?
No.
Any family with illnesses that you know of?
My grandmother on my dad's side had pancreatic cancer, and my dad's side has high cholesterol.
Okay. Do you have diabetes?
No.
Any hypertension?
No.
Any history of blood clots?
No.
Do you take any medications? This could be prescription, over-the-counter supplements.
I take vitamin C 1,000 milligrams and woman's multivitamin.
All right. Are you allergic to any medications?
Not that I am aware of.
Do you have any metabolic disorders like cystic fibrosis?
No.
Any history of infectious disease?
No.
Is there a chance that you could become pregnant?
No.
Are you currently using any form of contraception?
Yes, I have the Nexplanon implant.
Do you currently drive?
Not since the seizures happened. My cousin Tara drives me around.
Okay, good. Do you have any history of seizures?
No.
Muscular weakness?
Yes, after I had the seizures, I started getting muscle weakness throughout my body.
Okay, do you experience any headaches?
Yes, and a slight headache.
How would you explain these?
It kind of throbs throughout my head.
Do you experience any double vision?
Right after I wake up, but it goes away after a few seconds.
Any temporary loss of vision?
No.
Any blackouts?
I don't know, Tara, have you noticed anything?
I would definitely say that she blacks out while she's having a seizure. I mean, we've been living together for the last 8 months, and this just started happening all of a sudden about 2 weeks ago. And I don't know what really brings it on, but all of a sudden she blacks out, she loses consciousness, she starts shaking really hard, she makes really weird noises, her back will arch. It's really scary. And it usually lasts, I mean, it could be 30 seconds, but it just feels like it goes on forever.
So when was the last one?
The last one was yesterday.
Okay.
And before that, I've been keeping track because this is serious and we want to get it under control. Yeah. The last one before that was last Thursday, and then there was one last Monday as well. So there's been 3 in the last 2 weeks.
Okay, thank you so much for sharing that with me. I'm going to get Dr. Sawyer, and we will be reviewing all the information. She'll be with you shortly.
Thank you so much.
Thank you
for your time.
Thank you.
Hi, my name is Dr. Sawyer.
Hi.
How are you?
Good, how are you?
You must be Kirsten.
Yes.
Can you tell me your date of birth?
March 11th, 1994.
Okay, it's nice to meet you,
Nice to
Kirsten.
meet
And
you.
this is
My cousin Tara.
Tara. Nice to meet you.
Nice to meet you too.
I'm glad you're here. I know seizures can be a really scary event. So
Rough couple weeks.
yeah, so do you two live together?
Yes.
Okay, so you've witnessed and seen some things going on.
Yes.
Okay, good. So how long or how many seizures during this time?
Tara, can you?
I've been writing them down just so we can kind of be accurate as possible. She's had 3 in the last 2 weeks. The last one was yesterday, and then before that it was last Thursday and last Monday.
Wow, and nothing like this has ever happened before.
No, it was just very random.
Okay, so I've been reviewing your medical history, and you have no history of diabetes?
No.
And no injury? Nothing's
No.
happened like a fall, blow to the head, anything like that? Okay, so sometimes this can happen, and there's really not a lot of reason that we know why. And since there's been more than one in the past few weeks, it's a condition called epilepsy, and the condition's just really unknown. So there's a lot of medications out on the market that are really effective at controlling the seizures. One of the prescriptions I'm thinking that we'll prescribe you is called Dilantin. Have you heard of that before?
No, I have not.
Okay, so with this medication, it's very effective. So if you're taking it, it's really going to eliminate the seizures, and you're going to be able to live a really normal life.
Oh, perfect.
I know. So the only tricky part with this med is you need to take it 3 times a day. So you need to think of it like with meals: morning, afternoon, evening, and you have to take it consistently. So if this dose comes out and is not in your body, then you're going to likely experience the seizures again. So it's something you could help with too, to make sure that she's taking the medication.
Sarah will remind me.
She will help you. Good. Okay, so I see also in your history that you have a birth control method. What is it called?
It was the next one on implant.
The implant. Okay, so that's a reliable form of birth control,
Yes.
the implant. So it's important that you keep that intact while you're taking the medication. And the reason for that is this Dilantin is considered a pregnancy category X. And that means that there can be some risk to that unborn fetus. So it's really important that you take the medication. At some point, if you want to consider and plan to get pregnant, you need to come back and see me and we'll discuss your options for that. But for the time being, this is how we're going to start, and we're going to make sure you stay on the birth control as well.
Okay.
Does that make sense?
Yes.
Okay, good. All right, so do you guys have any questions for me?
I have a question.
Yeah.
So what happens if she has another seizure? Like, what do I do?
Okay, most important for you is to make sure that she's safe, so that she's not falling, she's not around anything where she can be injured while the seizure's going on. And then to call 911. That would be my recommendation right away. And especially even after the seizure is over, stay with her. Don't leave her alone, because she could be disoriented. She says she's blacked out. She has amnesia, right? You're not remembering.
Yeah.
So it's important that you stay with her and she's not moving on her own until help arrives.
Got it.
Does that make sense?
Yes.
Do you have any questions?
Yeah, so if I don't have seizures for a year and I'm still taking it, is it okay if I just stop taking it?
Talking it. It's a good question, and I can see how it would be tempting to think, well, for after a year the medication's working, why can't I just be done? And you know what? Sometimes it's possible that that's true. However, we would gradually take the medication away and see what happens, and I would monitor you really closely. So don't do that on your own. Come back and see me, and if we want to reevaluate at that time, then we can. And it's possible. It's possible, but. For now, we're going to start with this dose, and you're going to do it 3 times a day, and that's our first step.
Okay.
Okay.
Sounds good.
Any more questions?
I think that's it.
Okay, I think that this medication is really going to help you, and you're going to be feeling a lot better.
Thank you so much, Dr. Sawyer.
You're welcome. So I'm going to go get my nurse, and I'll write the prescription, and she's going to come back in, and she has a brochure and some more information she'll go through with you if you have questions.
Okay, sounds good.
All right.
Thank you.
Thank you.
Hi, I have a question about patient Pham in room 316.
Yeah.
I'm familiar with the anti-seizure medication phenobarbital, but I understand the doctor is prescribing Dilantin. Why is that?
So phenobarbital and Dilantin are both very effective at treating seizures, but Dilantin has less potential for CNS depression and abuse.
Oh, okay. Okay, that makes sense. Thanks for clarifying.
Yeah, of course. Good question. So now it's time to teach the patient about side effects. Do you feel comfortable teaching the patient about the medication?
I think so. I believe so. Yeah.
Okay, so you'll have this here, this pamphlet, to help guide you, and I'll be in there for support.
Okay, great.
Hi.
Hi, so we're going to be going over the pamphlet.
Okay.
So the doctor prescribed you Dilantin 100 milligrams. I'm going to go over it with you. You're going to be taking 1 capsule 3 times a day. You're going to be taking it when you wake up, before meals, and at bedtime. If your stomach feels upset at any time, you could probably eat it, take it after. You don't want to miss any doses. These are the common side effects: blurred speech, decreased coordination, drowsiness, confusion. The drowsiness, you need to be careful. You don't want to drive or operate heavy machinery, and it can cause an allergic reaction that can be very serious and potentially life-threatening. So if you have any of the following symptoms, make sure that you contact us or call 911.
Okay.
Fever, rash, swollen lymph nodes, swelling of the face, the eyes, the lips. It's very serious. Also, if you have any suicidal thoughts or actions, you're going to want to let us know about that so we can change the medication, reduce the therapeutic dose. Okay. Or if you're depression, do you have depression?
No.
Okay, good. If you get depression, make sure that you also notify us has any anxiety, give you panic attacks, trouble sleeping. Make sure that you don't drink alcohol while on Dilantin, or make sure you don't get pregnant. And that's it. I covered everything.
So one last thing, while using this medication, good dental hygiene is very important because an adverse effect of Dilantin is gingival hyperplasia and other complications.
What is that?
So basically what it is it's gum enlargement, so it's very important to have good dental hygiene.
Okay.
Also, Dr. Sawyer would like to see you in about 3 months for labs.
Okay. So do I just make an appointment up with the receptionist?
Yeah.
Okay.
These lab tests basically measure the amount of Dilantin in your system just so we can see that it's at a therapeutic level. Because too much can actually have those adverse effects that we spoke about, and too little can cause you to have seizures again.
Okay.
Yeah.
Thank you.
Thank you
You're
so much.
welcome.
Do you have any questions?
No, I think we're good.
Okay. Okay. Make sure you make that appointment.
Okay. Thank you.
Thank you so much.
Take care.